This is my disclosure. The study was funded by Contipi Medical. We developed a novel disposable vaginal device for the non-surgical management of POP. Now let's see the device, how it works.
The Provate device is designed to be inserted and removed like the menstrual tampon for easy use at home. Provate is inserted intuitively by the user with a single-use applicator. Pressing the plunger deploys and releases the Provate ring within the vagina, leaving the string available for removal at any time. The applicator is discarded. When desired, the user pulls the string and collapses the Provate ring, enabling quick and painless removal of the device for disposal.
The aim of this study was to demonstrate that the new disposable vaginal device does not alter vaginal microflora in a clinically significant manner as compared to a fresh and clean, commercially available ring pessary, as we termed it in the name COP. Subjects were randomized into starting with a Provate device or with a fresh, clean COP, following 14 to 16 days of washout period, and after another same washout period, they tried the second device. Swabs and cultures were taken before and after each study phase and sent to a single central lab in the United States. All in all, the study was multi-center, open-label, prospective, randomized, controlled, non-inferiority, statistically powered, crossover, home use study. The primary endpoint was based on a failure criteria. A subject was a failure if one of the following three failure parameters was met. The one was vaginal infections per lab results, the second was bothersome vaginal symptoms, and the third was vaginal symptoms that required treatment. As for the lab results, we tested 4 different microorganisms. The one was Lactobacillus, the second was Gardnerella vaginalis, and together we looked at the Nugent score, which had to be greater than 7 in order to fail. And we also looked at Staphylococcus aureus and Candida morphotypes, and again, they had to have at least 1 scale unit increase in order to be gathered as a failure. 58 subjects completed the study per protocol in 7 sites in the United States and in Israel. As we may see in the top table, failure rate was comparable between Provate device and the control COP. There were 9 failures with each of these devices. However, when we look down, and I'm referring you to the lower table, there were no vaginal infections at all with the Provate device, and there were 9 cases of microfloral fluctuations. When we looked at the control device, there were 1 case of vaginal infection, 2 bothersome vaginal symptoms, and 6 cases of microfloral fluctuations. In other words, most failure cases were actually contributed by microfloral fluctuations, which occur spontaneously, almost on a daily basis, in most women, and are not considered vaginal infections. To conclude, the usage of a disposable device showed no significant impact on vaginal infection rate. Results were comparable to those achieved while using a fresh and clean COP. Just to note something else, that when we added results from this study to a previous study, and we looked at 5,442 usage days with about 2,000 devices, there were neither signs nor symptoms of vaginal infections while using a fresh and clean disposable device. Thank you very much.
Thank you very much, Dr. Ehrlich. Professor Vic Kullar has a question.
Yes, Kullar London. Obviously, we know that a number of women with prolapse will be postmenopausal, and postmenopausal women are more at risk of getting vaginitis or vaginal infections. Did you notice any relationship?
Not at all. This was a bit strange. We thought there will be a difference, but we didn't see any difference. In fact, we just as requested, and by the way, this study was designed by FDA for us, we noted that some women at the beginning had like E. coli in the vagina, mostly the postmenopausal women, as you stated, which is almost, this is the drug of choice here in the vagina. But the point here is that there was no difference at all between the 2 populations, at least in our study.
Was that possibly because the postmenopausal women were using vaginal estrogens?
Not all of them. In these, In this study, about 15% were premenopausal, the rest, about 85, were postmenopausal. Only 6 women were using any estrogen cream, whether it's cream or tablet.
Obviously, you had women of different ages and different parity. You saw no differences there. And what was the duration of the use of this device?
We use the device. We allow the women to use the devices as much as they wished in the case of the disposable device, but we ask them to have at least 26 days of usage in each month. Altogether, all devices were used for somewhere like 30 plus minus 3 days.
Please.
Delia from the Netherlands. A typical Dutch question: how long can one use one device, and what does it cost compared to the normal pessaries?
Okay, good. The device was actually designed to be used for up to 7 days. When I say up to 7 days, it means a woman can insert the device in the morning and decide that she wants to have intercourse in the evening, take it out. This is up to her. One of the things about such devices is that this moves the control into the hands of the woman. As I said, she's allowed to use the device for up to 7 days, but the real length is up to her. As for the costs, and I'm talking mainly about the United States, the cost will be comparable to what happens in the United States when we talk about payments to the doctors and payments for the device itself. Altogether, it's about $3.50 per device.
Time is almost up, but can I just quickly ask, who sizes the device for the woman?
In this case, we want the doctors to be the ones who sees the device, the woman first. There are 6 sizes. She has to be sized. The right size for her has to be determined before she starts that. So the doctors are part of this procedure.
Thank you very much.
Thank you.
We're going to